Hello, and good afternoon to everyone. This is Dr. J here at AsktheGynaecologist, and this afternoon I'll be talking about IVF. It's been a while I came on live. Honestly, I wish I can explain everything all, but not all the time you can explain things to people. It's been a wonderful time, busy, obviously, and once more, I'm happy to be here. And Dr. J, your one and only, and I'll be talking about how to improve your chances of success at IVF, the things you should do, the things I wish you'd know before you go for IVF. I'll be talking about these things today, and it's just because over the last 48 hours, I've been receiving questions, people asking questions about how they can get their body prepared for IVF. So therefore, I've chosen this topic to be the thing we're going to talk about today. My name is Dr. Alalade at AsktheGynaecologist, and if you don't know me, you are on the best show on internet, on the social media, on Facebook. I want to do a quick sound check. I hope everybody can listen to me well and you can hear me properly. I can see Abigail Titilola Agbaoye. Thank you for being here to listen to us talk today. Once again, my name is your one and only Dr. J, Dr. Babajide Alalade. You're one of your team members, Ask the Gynaecologist here. Thank you. I can see people already on live on Instagram over there, and we are recording simultaneously on Facebook. We are live on Facebook, and also we are on YouTube. If this is your first time coming to our Ask the Gynaecologist meeting, it's the best time you will ever be. And if your friends are not here, please just go and tell them that we talk about gynecological concerns here, and what we do is free discussions. But obviously, if you want one-to-one discussion, then you have to go through the premium services. I'm happy and I'm delighted to be alive today. It's been hectic for me, and I'm happy that God has given us opportunity to be here live. Without wasting too much time, I'll quickly go on to the crack of the day, to the meat of the action. And obviously, people are worried. People want to know how they can get their body toned up, ready for IVF. First of all, what is IVF? IVF, as we know, is in vitro fertilization. It's under the artificial reproductive technology, what we call ART, artificial reproductive technology, to assist men and women, or either of them, to be able to get pregnant. Okay, so before I start, I'll quickly welcome people coming up live. I can see Kokole Tomi Femi, Lola Majek Kudaisi, Obi Bright, Agbola Tunrayo, Ayola Luashim, Alicia Reis, Oluwatosin Kusanya, One Ifioma Otusi, Emebo Ebere Lilian, Agbola Tunrayo, Oju Okonkwo, Precious Onumajuru, Peace Onya, Anolika Ebelekwe Ezeze, Olori Abisoye Ige, Double Olori. How are you today? And I can see many of our people. Cheers Okachukuma, Olori Badebo, Nikelayade Akinyade, Kokolet. And on Instagram, I can see people, but unfortunately, it's difficult to pronounce the names on Instagram because they're like kind of acronyms. Anyhow, we are here. Anyhow, I'm here. Like I said earlier, my name is Dr. Alalade. You can see that obviously on my shirt here. And we are Ask the Gynaecologist. IVF is a very, very important phase in a woman's life. First of all, it takes a lot of convincing and a lot of sometimes trauma, sometimes digestion of information for a woman or for a couple, most importantly, to come to terms with the fact that they might need IVF to conceive. Sometimes it's a slap on their face, sometimes it's a blow to their ego that we need help. And sometimes I can tell you something, it's not always easy for a couple, most especially for men in the family, to accept the fact that they might need help to conceive. Sometimes in some settings, the husband or the wife, either way, might not be in support of what might be needed. And some men will think, oh, probably it's not my fault, so it's your problem. So some women will think it's your problem, it's not my problem. But when infertility arises in the family, it's a blow on the marriage, it's a blow on the union. And it's important that as couples, it's important as husband and wife, it's important as man and woman that two of you work together. Whoever has the challenge, whoever has the diagnosis of infertility, or even if it's both of the parties involved, is important and it's paramount that both of you work together. Both of you attend clinical sessions together. Both of you understand each other and carry each other along, because it's not a battle for one person to fight. Sometimes, if, for example, now, if it's the woman, sometimes you get worried. If you were at the seminar we did in April, I had a lady, she gave her whole life story about her journey through infertility. Sometimes some men want to know what their wives are going through, but sometimes some women think the man is not supposed to know, and the men will have difficulty to even understand and get into your world. So try and carry your husband along. Don't worry how he processes the information. Just carry him along with open heart, with love, and leave the rest to God to interpret and to assist him to understand the whole thing. And if it's the other way, if the man has a problem, for example, husbands, carry your wives along. Don't think you're a failure. Don't think you're a weakling. Leave the woman to process the information as how she wants it. Because I've heard people, and I'm sure as you listen to me, you'll have seen a lot of women. Maybe their husband has issues. Maybe they'll go and get pregnant for someone else, and they'll go and hide it for the man. Sometimes you see some men too, because their wife has problems, they'll go and get some other girlfriend pregnant outside. It's not the way to solve problems. It will probably cause issues for yourself, for the children, in future. And then you have to start dealing with the pieces, with the broken fences and with the broken walls. So it's not always good for you to go outside marriage to start having things. I know there's a lot of pressure in our society. It will not go away. Our society is designed that there'll be pressures with man or woman that are not able to get pregnant. Okay? So about the cost of IVF, Larry, hold on. Okay, we're talking about how to get your body ready for IVF. The cost will get there. Getting your body ready to covers the cost. Yes, but I'll give you different ideas how people can come to terms and come to grasp regarding preparation for the cost of IVF. Okay, so follow me as I take you on this journey. It's my pleasure to be your guide today. Okay, so hold on and let us go together. Now, first of all, when a couple is given diagnosis of infertility, that they need IVF, definitely some tests must have been done, and they will have highlighted to you. Most cases they'll say, oh, there's a male cause of infertility, low sperm count or no sperm count. They will have said, okay, is the woman's issue, there's blocked tubes, or she's not ovulating, or or they'll say, okay, it's both of you. So one person has this problem, the other person has that problem, and on the fourth instance, they might say even it's unknown cause. We don't even know the cause of the infertility to start with. So it could go either of the four ways, And like I always say all the time here, first of all, when you are given the idea that you might need IVF, the first thing first is to know why you need IVF. Okay, why are you going for IVF? I've seen people, they've come to me, they've been trying to get pregnant for about 2-3 years. And they say they did IVF. Okay, if you need IVF, why are we here? So we can know how and what form of IVF to give to you. They say, I just think I need IVF. Okay, what test have you done? I haven't done any test. Just that we're trying to get pregnant and no pregnancy has happened yet. Yes, definitely you might need IVF. Don't worry. But IVF comes in different forms. When we say IVF, imagine IVF as a big room, as a big house. In that house, there are different rooms. You might pass one room to get to the other room. You might pass one room to go out again. You might go to a different door or enter through a different door. IVF is basically putting the egg or the sperm or the fertilized egg, that is union of egg and sperm, embryo, into the womb. How we get it done is the process of IVF. So first of all, some people, okay, they have good sperm, they have good egg, but they just can't get pregnant for reasons we don't know. They might need IVF or no causes. Some people, they're not ovulating, the sperm is good, okay? So for them, not ovulating, we get the donor egg, we put their husband's sperm into the egg, fertilize it, and put it back in. Put it back into the womb when the womb is ready. So it's a way we prepare the womb to receive the incoming egg. Some people, they are not ovulating. Some people, this is the same couple, their husband has no sperm. We borrow sperm, we borrow egg from donors, put them together in the laboratory, incubate them, and implant it into the womb, getting the womb ready. Okay. Some people, okay, it's just that for some reason they're not getting pregnant. the sperm is a bit low, she's ovulating, we can do simple IUI, intrauterine insemination. That is not it's not a real IVF anyway. It's basically taking the sperm in the laboratory, spinning the semen, getting the sperm out and putting it directly to get the woman pregnant. Sometimes we stimulate the woman womb to get ready and we put the sperm in. IUI, in most cases for IUI, we don't use any medication to stimulate the womb sometimes, so it's much cheaper than the typical IVF. So IUI is intrauterine insemination and is basically used when the man has the problem. Okay, there's another one called ICSI, intracytoplasmic sperm injection. Intracytoplasmic sperm injection. Don't worry about the name, just know it's called ICSI. ICSI. Indigo Charlie Sugar Indigo. Indigo Charlie Sugar Indigo. ICSI. ICSI. ICSI basically, okay, is when the man has a problem. Okay, and the sperm is totally problematic. There's a way we can go and sequester and get the best sperm, and then we put into the womb or put into the egg to fertilize the egg that we got from our woman, and we put it back into the womb. In some cases, the man is not producing sperm at all. We can go and look for sperm in the testicles. We do what we call surgical sperm aspiration. We retrieve the sperm through different surgical means. So we check the sperm is okay on microscope. We get the egg after stimulating the woman's ovary to get egg, fertilize the egg and put it back in. Surgical sperm aspiration plus IVF. So IVF has different rooms. So imagine all those things. So somebody will need IVF, okay, but they will need donor egg. They might need donor sperm. They might need donor embryo. They might even require us to even freeze the egg or freeze the sperm for future use. Some people, they might even need for us to go and aspirate the sperm from the man's testicles. Some people, they need ICSI. Some people, they just need simple IUI. So all these things come in different ways, okay? But what is common to all of them is IVF, okay? Is what IVF, using artificial technology to get the family, the couple, pregnant. If you go to most centers, okay, there's always a range of IVF cost. But the good thing is that because of so many people entering into the IVF space now, IVF cost is coming down everywhere in Nigeria, which is a good thing and it's very essential. Let me tell you something. IVF itself, okay, is relatively cheap in Nigeria compared to other prices in the world. Okay, in a typical place in America, IVF will cost you between or northwards of $10,000. That's equivalent of close to 6 million naira. Fact. And in fact, in some places, very posh places, to go up to $20,000, close to 12 million naira in America. In UK, average of 6 to 7,000 pounds, that is close to about 3.5 million naira. You pay for IVF here privately. Some cases too in UK here, you get it paid for under NHS, but in most cases, you pay for it privately yourself. But if you go to Nigeria, IVF is between close to 1.2 million to the northward side of 1.5 to 1.6, depending on the location. Obviously, Abuja, Port Harcourt, and Lagos Island is more expensive. Or on the VI or Ikoyi, it's much expensive when you look at the price. In some centers too, they offer you opportunity to do family balancing, gender selection, okay, and it can be done as well to ensure that you can balance your family if you want. Okay, in some countries in the world, they don't do that. In some places in Nigeria, that can be affordable for you, that can be done, but that will come with extra cost because that is basically your choice. Okay, most important, let me tell you something, whether boy or girl, it doesn't matter. As far as your child is healthy and your child is good in good condition, that is the most important. Okay, now seeing the most, don't worry about the conversion. I'm not very good at conversion. Okay, since you know what $10,000 is, that's fine. Just convert it yourself. Don't worry about the price. But that's what that's what it is in America on average. I'm not talking about conversion. I'm not the typical Balam that exchanges currency. I'm not good with the currency conversion. So you do the arithmetics, okay? You do the maths there. You're very and Cindy, I'm sure once you get it done, kindly post it back on the screen. And that'll be very, very good. So post it back on the screen to us when you've done the arithmetic, since you're very good with that summation. God bless you. So, but however, like I always say, in ATG, we have opportunity to get you to do IVF in our center now, which opens in the next 2-3 weeks, June this year. By the way, now the topic of today is how to get your body in shape. How to get your body in shape. and ready for IVF. Okay? The first things first is to know what is the reason for the IVF in the first instance. Is it ovulation failure? You're not ovulating anymore? Is it the husband's sperm that is not good? Okay? Is it that the seminiferous tubes are blocked and maybe we can still get sperm from his testicles? Or is it the fact that your tubes are blocked, your fallopian tubes? Okay? Is it just because both of you have problems? Or is it because there's unknown cause and you've been trying for so long and nobody's able to get pregnant? So those are possible reasons why IVF might be the case. So therefore, there are important tests which you must do to know the cause of problems, to know the reason why your IVF is a problem, or to know the reason why you need IVF. I'll talk to you later before I finish about why IVF can fail. To get to that journey, okay, to know whether you need IVF or why you need IVF, definitely we must have done some tests for you, which are what we call hormonal profile tests. Your hormonal profile, which everybody knows now in ATG. If you're an ATG member, you should know all these things now. They are our ABC 1, 2, 3 times table here. Your hormonal profile contains what? FSH, LH, which must be done between day 2 to 5 of your cycle. We do your prolactin as well at any time during your menstrual cycle. We do your day 21 progesterone if you have a regular cycle. We check your tubes if they are open or blocked through HSG. Sometimes we can do laparoscopy and dye tests to check your tubes too. We do ultrasound scan to check for any ovarian cysts, endometrial cysts on your ovary. And we do basic scan to check that even that person has a womb in the first instance. Obviously, we have to do your seminal fluid analysis for your husband. It's also important that we do your rubella, your rubella status. We want to know whether you are immune to rubella. Okay? And if you're not immune to rubella, we want to get you vaccinated on time so that you don't have rubella infection during pregnancy that can increase the risk of babies having problems before they are born or even after they are born. So we do all those basic tests first of all. Once we've done this test, we can now highlight where the problem is. For example, if someone has high FSH more than 30. I was talking to a lady today, her FSH is 72.6. Definitely, that means that she's not ovulating anymore. So if your FSH is more than 30 on 2 occasions apart, 60 and between 6 weeks. So if we do your FSH now, today is 30. We do it again in 6 weeks' time, it's still 30 or more. That means that you're probably not ovulating anymore. So all this will give us a guide whether you are going through ovulation failure or you've gone through premature ovulation failure, ovulatory failure. I mean, that is through your FSH to your LH. That will give us opportunity to know whether you have ovulatory failure, or you've gone through menopause, or you've gone through premature menopause. Aside, we do HSG to check whether your tubes are blocked. We do laparoscopy and dye tests to know whether your tubes are blocked. That can be done at any time. Importantly as well, it's also important to know whether you're having regular cycles. Most people that are having regular cycles, 80% of them are ovulating. If you're having regular cycles, out of 5 people that are having regular cycles, 4 of them or more are actually ovulating. So we do your day 21 progesterone on your day 21 of your cycle. Day 21 is simple. The first day of your bleeding is day 1. Count 21 days. You get to day 21, go and do your day 21 progesterone. Progesterone is important, and if it's more than 18 or more than 20, it's a sure sign that you're ovulating. Sometimes it's still about 12. You can still be ovulating. But if someone has progesterone, day 21, more than 18, more than 19, they're definitely ovulating in most cases. We check your prolactin level. If your prolactin is too high, it will tell your body not to ovulate. So if you have high prolactin, that means that you're not ovulating in most cases. So we have to treat it. Like I said again, we check your husband's sperm count to know if it's still producing sperm, and we check your chlamydia, gonorrhea, to check your swabs to see that you have any infection. Infections are notorious that they cause blockage in your tubes, and if your tubes are blocked, what we try to do in some cases is to do hydrotubation, but in most cases, only 1 out of every 4 people or less do they have success with hydrotubation. If your tubes are blocked, you might need IVF, to be honest with you. If you're not ovulating at all, you've gone through menopause, surgical or premature, or natural menopause, you're probably not ovulating anymore, and you might need definitely egg donor or some sort to get pregnant. Now, you've known all this. You've known the reason why you and your husband, the couple, are going for the IVF. What should you do in the first instance to get your body fixed up? Okay. If you've been following me all the time in ATG here, I always tell people this is fact, that once a woman is born, the amount of eggs you carry all life has already been given to you. Nobody can increase your egg count. I've seen people already chatting me here, asking questions now here on Facebook, on Instagram, that how can they increase their egg count? Let me tell you the truth. Once you're born, the amount of eggs you have in your body will only decrease in quantity and quality as you get older. Much more. So once you cross age 35, the quality and the quantity will start to decrease fast astronomically. So therefore, it's always very good to get pregnant as soon as possible before age 35. Worst case scenario, before age 40. That is just a theoretical fact. Some people too get pregnant after 40 anyway. There's nothing God can't do. But in most cases, it's much better to have them much earlier if you can. If you can, and whenever you can. All to you. So, back to a point. If you've been told you need IVF, the first thing first is to know the cost of IVF. You want to know what will you need extra. For example, to get yourself ready for IVF, if it's just simple IVF, you're ovulating, just that your tubes are blocked, your husband's sperm count is good, what we need to do is to stimulate you, program your cycle, get your eggs out. Get your husband's sperm produced by masturbation or some other means. Fertilize the egg, becoming embryo, watch them grow, divide in the laboratory in the incubator. Then once your womb is ready to receive them, we implant them. Easy, case closed. Do test of pregnancy 2 weeks time. Number one. Number two, you need IVF. Your husband's sperm is not good. Maybe we need to do surgical sperm aspiration. You can aspirate the sperm. There's an extra cost for that. You get the sperm out, get the best of all the sperm in the semen, get your womb ready, or maybe we are stimulating you, get your egg out, fertilize them in the laboratory, in the incubator for about 3 to 5 days, get them to develop into a good, lovely blastocyst state. That's what we call them. Transfer the embryo back into your womb. Chicken, we take the box. 2 weeks afterwards, you're pregnant, all good. A lady got pregnant this weekend here. I'll leave that for another day. That's one. Number two, if, for example, you're not producing eggs at all, and we have to get egg donor from you, well, for someone, we get an egg donor. We screen the person, do the test appropriately. Getting egg donor carries a bit extra cost, but that will be done anyway under your IVF cost, okay? Some cases too, some places, the egg donor cost is separate. Like in ATG, egg donor cost is very, very minimal and separate. So you get the cost. Now, if you want to know the cost of lab test, IVF test at ATG Laboratory IVF Center, just call my secretary, our lab manager, tomorrow morning. She will answer your questions. You can text her too on that number on your screen, and she'll give you all the cost details as soon as possible so you can know what to expect. Like I said again, the first thing you must know is the cost. So you've done all these things and you've known what sort of IVF you need, what other tests you need, what other things you need, maybe to freeze the eggs, to freeze the sperm, to do egg donor, to do sperm donor, all those things, to do surgical sperm aspiration. Along the line, you might need scans. All these follicular tracking scans, they are factored in. Okay? So once you get a cost, start working towards it. In some cases, like our ATG IVF Center, you can open an account with a manager and you can put your money there sequentially, instrumentally. And once your money is complete, you can do the procedure. And if you get pregnant naturally before your money is complete, safe, or before you start any of our IVF procedure, we give you your money back all complete. Obviously, no interest, but we give you your money back completely, full refund. That is if you get pregnant before you institute or before you start the IVF procedure. We give you full refund back. That is me. If you've known me for the last 5 years here, I'm a person that I put my face behind my words. By the grace of God, God will not fail me. God will not put me to shame by God's grace. If you get pregnant before the IVF starts, we get your money back. Case closed. Your money is not mine. Your money is to pay people that are obviously going to work to get you people pregnant. ATG IVF Center was built debt-free to ensure that our focus in ATG is just your convenience. It's just your joy. It's not any profit, anything. And I've put a lot of my sweat, a lot of my time, even of our team members here, moderators, to ensure that ATG is debt-free and the things we offer you are totally financed by the grace of God from my own pocket. It's my joy. And that's my vision, that one day I'll be able to change lives and bring joy to people's homes from where I am, from my own comfort, from my own home to yours. So that's one. Now, if you're going for IVF, you've known, it's important you factor in the cost of your hotel travel, the cost of your hotel travel, the cost of your ticket. And it's important you establish communication link with the IVF nurse at the IVF center and with your doctor so that you know what tests to do, if there's any test for you to do before you come over to the country. For example, now if you live in Nigeria, you're in America, UK, Italy, Europe, Germany, somewhere there, or in Japan, or somewhere far away, and you want to travel to Nigeria, Lagos, for example, to ATG IVF Center for your IVF, you need to talk to me or talk to our IVF specialist down there or our manager so they can tell you things you should do before coming. At least you get your hotel booked yourself or to get your tickets booked, and you take some time off. Factor in between 5 to 7 weeks. Okay? In some cases, maybe your husband has to go back. Your husband has to go back to your location so that two of you will not be out of work. It's always a good thing to discuss how to freeze the sperm at the IVF center so that it will reduce the waiting time. You can go back and while you continue the process, okay? But if it's going to be around, it's better because at least two of you be together to support each other. That is very, very important for emotional well-being. But if by all means he has to go back, these things happen, it's not easy to keep two able-bodied working adults out of job. So if you have to go back, yes, that's fine. Then work with the IVF team. We can freeze the sperm and keep it under perfect condition while your process and treatment is going on. In most cases, we tend to take over your menstrual cycle and then stimulate your ovaries to produce eggs. We retrieve the eggs, keep them in the incubator, take your husband's sperm from where it is or from sperm donor, fertilize the egg, put it in the incubator, watch it grow, okay, in the culture media, okay. Once it's very good, we now put them back into you with that is your womb ready to receive the egg. That is it. It's important that you know this as well, that if you're coming for IVF, you must, if possible, husband and wife, don't smoke. If you're a smoker as a lady, stop it. If you're a smoker as a man, stop it. Totally. And it's very important for both people to listen to this. If you are working in a place that is very, very full of dust and all this exhaust, cover your nose. Now, thank God that there's COVID now. Everybody's covering their nose with mask. It's important. Number 2, people with high BMI. What is BMI? Body Mass Index. Just go on Google, type in BMI, Bravo Mama India. BMI, Bravo Mama Indigo, Bravo Mama India. It will give you how to calculate your BMI. Your BMI is a ratio of what? Your weight in kilograms over your height in meter squared. Don't worry about the formula. Just go on Google, put the numbers there. It will give you your BMI. Your BMI ideally should be between 19.5 to 30 to get you fit and ready for BMI. In most centers, if your BMI is more than 30, 31 and above, they won't do your IVF. So you only want to get to the IVF center after traveling so long distance, after spending so much money, and they tell you to postpone IVF for the next 1 or 2 months just for you to bring your BMI down. So you have to eat the gym. Lose belly fat. The most important fat you need to lose in most cases are your fat in your belly, in your thigh, and in your hams. Those are the common places where people store fat. Belly and side, upper thigh, and in your hams. So go to the gym, build your upper muscles, build your and strengthen your lower tummy muscles, and firm your thighs. Regular exercise. If possible, get a gym instructor. If you're able to, get a proper gym in your house. If you're able to, if not, get a gym instructor to teach you things what to do, and if possible, to use an app that will tell you what to do, how many calories and kilograms to burn regularly, and what to do consistently and sustained, and that is sustainable. Some people I've seen them, they use apps that can help them count their calories so that you're losing weight, and it works for them. Whatever works for you, do. And you can even join groups on social media that facilitate and help you to lose weight. By working and doing these things in a group, it works better and faster. Once you have people doing the same thing with you, it's easier for you to chorus and carry on along. That is important. Watch what you eat. You're smoking, you're drinking alcohol, lots of carbohydrate is not good. As a man, if you're a smoker, your wife is going for IVF, smoking can destroy sperm. Smoking can destroy sperm. Alcohol, excessive consumption of caffeine and alcohol. Caffeine, alcohol, beer, Smirnoff, all those brandy, all those schnapps and all stuff like that, they contain massive amount of chemical. Don't make your body a chemical body. I know our body is full of biochemical carbons, but don't make your body full of chemical and don't ingest chemical unnecessarily. Stop and cut alcohol, cut caffeine. IVF takes about 5 to 7 weeks in most cases. Okay, if there are issues along the line, it might delay further. But in most cases, if everything goes well according and you're following my advice today, IVF does not take more than 5 to 7 weeks. Okay, to make it shorter is difficult. Some places they can do it for 3 weeks, yes, but I don't want to get you over unless you worked up. But if you're IVF, they can get everything done within 3 weeks. That's fine. But in most cases, it takes 5 to 7 weeks. Okay. Now, it's important that if you're taking contraception, you obviously, it sounds silly. Someone trying to get pregnant is on contraception. It can happen. I've seen people, they're trying to get pregnant and they're on contraception and they don't know. Some people, they've put coil in their vagina, in their womb cavity for 10 years ago and they've forgotten it there. Go and get a scan done for someone to check your womb properly. It's important. The best type of food to eat is food that are very high in carbohydrate, food that are very, very high in iron, in calcium, okay, high in magnesium, okay, eggs, green food, vegetables. Don't overcook your vegetable. Overcooking vegetables destroys all the benefits in the vegetable. If possible, heat vegetable, wash clean and close to raw. They contain more nutrients with that, and they work better and they replenish your body faster and easier. So protein that are rich in food that are rich in protein, foods that are low in carbohydrates, high in calcium, high in magnesium, high in iron are the best for you. Okay, especially those. If you put all this into consideration, you realize that those food that contain all these things I've mentioned are the green vegetables, your eggs, your green vegetables, your fruits. They contain all these things. They're cheap, they're affordable, do them. And if you're trying to get pregnant, it's important, paramountly important, that you start your folic acid 5 milligrams at least 3 months before your IVF. Folic acid was started at least 3 months before your IVF. Okay, it's important. And most important thing I tell people all the time is DHEA. For the girls, for the ladies, ensure you are taking your DHEA. What is DHEA? D for Delta, H for Henry, E for Echo, A for Alpha. D for Delta, H for Henry, E for Echo, E for Elephant, and A for Alpha. A for Alpha. DHEA contain antioxidants. Now, there's no medication in the world that will increase or boost your egg count. Like I said earlier, once you're born as a lady, the amount of eggs you carry all life has already been deposited into you. Nobody can increase or decrease. Nobody can increase the egg count. The egg count will decrease as you get older with time, with age, in quality and in quality. But these antioxidants, your fruits, your vegetables, antioxidants in the DHEA, they slow down the aging process. We are going to get old, but the rate of getting old is slower for some people, and you think they're getting younger. So we're all going to get old, but you can slow down the aging process by living healthy. DHEA contains antioxidants that will help to slow down the aging process of the eggs. They don't make you to boost your eggs, but they slow down the aging process. I was talking to a lady today about 2 hours ago, and she was all about how to boost her eggs. And I made her to understand that I would be candid with her that there's no way you can boost your eggs number. You can only reduce the aging process of your eggs. And I told her to take DHEA. It's important that men to take Proxid. If your sperm count, your husband's sperm count is on the lower side of normal or borderline or just average, take medications that are called Proxid. Okay, Proxid, Proxid, Papa, Romeo, Orange, X for X-ray, E for Echo, D for Delta. Proxid, they help to boost sperm count. Or Adizua, A for Alpha, Delta, Yankee, Zulu, Oscar, Alpha. A for Alpha, D for Delta. Okay, Y for Yankee, Z for Zulu, O for Orange, A for Alpha. Adizua has these antioxidants too, containing zinc and selenium that reduce the aging process of sperm. Very important for the men. And it's important while you're trying to do IVF, you start taking folic acid, like I said, and also whenever you go and have sex with your husband, you use lubricant called Proxid. P for Papa, R for Romeo, E for Echo, S for Sugar, Echo, Delta. Proxid is different from Proxid. Proxid lubricant does not increase sperm count, but it facilitates and aids in the mobility and making the vaginal environment conducive for sperm optimization and sperm transport as well. It's like when you drive your car on a newly tarred road. You know that soft feeling, the happiness, the joy you have when you're driving on a newly tarred road, and it's like see the whole world is listening to you. That is the same feeling that the vagina that is conduced, okay, with that lubricant pre-seed gives to sperm transport. It's like when you're skating on highs on the islands, when you're skating on highs on the Pyrenees, you see, it's so lovely. It's like you're gliding, and you're moving fast. The same thing to this lubricant gives to sperm. But I've seen people that say that this lubricant makes their period irregular. It's so unusual because the lubricant hasn't got any really hormone. But if it's making your period irregular, by all means stop it. But there are also other types of lubricants that are also similar to pre-seed, and they are very useful. I've used it before. That's why you know what I'm saying. So you can use them. So, but if you're confused about what you use, text me through our consult services, text me through our premium services, and I'll go through what you have and be able to give you a guide or answer your questions regarding what sort of lubricant, what sort of antioxidants like DHEA to use to make your journey smoother, faster, and better. It's also important while you're going for IVF that you institute some sort of relaxation technique. People have different relaxation techniques that works for them, okay? People do have different things. We all have different backgrounds, different religious backgrounds, different beliefs. But at the end of the day, these things come into one end to make our mind peaceful, to give us peace of mind. While you're going for infertility, anything, and I say anything, and I mean anything that denies you peace of mind, and anything that robs you of your peace of mind, avoid. I don't care what it is, even if it's your body, if it's yourself, whatever robs you of peace of mind, whatever robs you of your faith in belief in your God, while going for IVF, take it away. You cannot have negativity while on the journey for IVF. And I've spoken to people, I've realized that 80 out of every 100 people that have failure in the IVF, they thought and they knew was going to fail. Lucky people that we call lucky in quotes, they always expect good to come their way. The people we call lucky, most times they expect and they believe that good things will come to them. There's no need in you going for IVF if you think it's going to fail. Don't go. For example, I'm a trader. I trade online. I trade stocks all the time. Until I have that firm conviction that I'm going to make money online trading, do I institute any trade? If I'm not comfortable or I don't feel that feeling within me to institute a trade, I don't touch the market. If you think that by going for IVF, you think you're going to fail, don't start that journey yet. It's too expensive to fail. A typical IVF average goes to close to 1.2 million northwards. Why are you going to throw that kind of money down the drain? Close to 1,700 pounds. Chill. Take a step back. Go when you're ready. Peace of mind, comfort, positivity. It's important. Everything that you can do to give your mind peace of mind, give you joy, stability, peace of mind. Don't deny yourself of it. If you're a man, give your wife peace of mind. Anything that she needs to make her life comfortable, do, as far as it's not going to rob you too of your own peace of mind. If you're a woman, anything your man needs to have peace of mind, doing that journey, give it to him and do it for them, as far as it will rob you too of your own peace of mind. Anything you do for somebody that will rob you of your peace of mind is not giving you that person, it's not giving you or that person peace of mind. Anything you do that will rob you of your peace of mind is not going to do that person peace of mind, neither is it going to do you good or give you peace of mind. I can say that 9 out of 10 times comfortably from experience, most importantly. Now, what amazes me in most cases is that after people have been given advice regarding what to do during IVF, they don't listen. Out of 4 people that go for IVF, 2 will not listen to advice. They will think they know more than a doctor. They will tell them to do this. They'll say, why not this? Why not that? There's nothing wrong in you asking questions from a doctor. In fact, I've realized that most patients that do ask questions, okay, is because They want to know more about their body. And if you want to know more about your body, it gives me an idea that this person will probably get a better outcome from their journey and experience. There's no need you trying to confuse your doctor by hiding things from them. There's no need you confuse your doctor that they will give you advice. You can do another thing at the back. And then it's when it's gone wrong, then you now come out and say, it didn't go well, though. Meanwhile, the doctor has even lost track of you. A lot of people register on Diamond Service. I tell them to do 1, 2, 3 things. They go away for 2 months, they won't come back. And they go and do something somewhere. And when things doesn't go according to your plan or things go pear-shaped, they now come back, doctor, it didn't go well, though. I'm like, what happened? I haven't talked to you in so long. They now start confessing and start giving you details. You now wonder, when did all this happen? Some people say, but doctor, you didn't call me since then. Look, I can't go and knock people's doors. I'm a doctor. You registered with me. You knock on my door anytime. My job is my obligation is to open the door for you and answer you. People register on ATG service. You registered here and you don't bring details to me. I tell you to bring 1, 2, 3, do 1, 2, 3 things. They don't do them. Do this, do this, do this. They don't do them. Even in the Bible, they said, whatever it tells you to do, do. Okay, I'm using Bible as an example because I read Bible all the time, you know. But in any religion too, there's a portion for obeying. Even in Islam, there's a portion where you must obey. You must obey Allah. You must obey the Prophet. You must obey the founding fathers. And you must obey the tenets of Islam. In every religion, even Buddhism, Confucianism, any religion, there's a portion for you to obey. The same thing too, when you're trying to do any apprenticeship, you obey your masters. You come to a professional. If my mechanic says my brakes needs to be changed, I tell them, how soon can I change it? And how long do I have? I don't argue with them. It's not my specialty. I tell you how much more about your body. Do 1, 2, 3 things. People will have every reason not to do the actual things you say you want to do. Okay, do what you want to do. They still won't do. Some people have that problem in taking the first step. Take the first step and do one thing. One thing will lead to the next, until you lead to the next, and you get to your destination. The journey of 1,000 miles begins with one step. But failure to take that step, you will delay your journey and delay your destiny. You want to carry your baby in your hands. I tell you, you come to ATG, do 1, 2, 3, 4, 5, 6 tests. Let us see what his problem is. People say, no, I've done everything, it's okay. Okay, give us the test. I don't have it. Okay, can you get it somewhere? I can't get it. Okay, can you repeat them all over again? I can't do it. Okay, so you want me to work as a magician and start concocting things from the either? I can do that if you want, but it's probably not going to be in your best interest. So always obey, or try as much as possible to obey. And if you're a man too, assist your wife to obey. Don't make it difficult. I've seen men, the only thing they need to do is semen analysis, and they won't do it. They won't do it. It doesn't cost you more than $5,000 or less in most labs to do semen analysis. And I don't understand why it's difficult for some men to come to terms to answer and go. I don't hate men. So if you're a man, don't think I'm firing bullets at you. No, don't get it wrong. But just do these things. At least we know where the problem is, and we can tackle it on time as soon as possible. Okay. Now you've done everything. You've done everything. You've done your IVF. You've done everything. There's a time that you wait. I've seen people, they've done everything they're supposed to do. They did IVF yesterday, and they want to see test of pregnancy positive tomorrow. There's a period of planting and a period of you seeing the plants come up. You can't put a seed in the ground and you go and start digging it again tomorrow to see if it's growing. You have to wait and allow it to come up the surface of the soil. There's a period for patience. There's a period for waiting. And there's a period to see your answers to your prayers. Once you've planted the seeds, you don't go and start digging to see, is this bean seed growing? You wait for it to grow. A lady came to me yesterday. She had IVF transfer on Thursday. And she's asking me, when should she see test of pregnancy positive? I said, ideally, you wait for 2 weeks for you to see test of pregnancy. But she wants to do it today. I said, fine, go ahead and do it. She said it's negative. I said, I'm not surprised. It takes a while. 2 weeks from implantation, 2 weeks from transfer. She said she knew that already. So why don't you want to wait? She wants to know now. She wants to, okay, now because she's not showing, can she go and do scan? I'm like, no scan will pick up pregnancy less than 5-6 weeks pregnant. Scans don't pick up pregnancy because you're pregnant in 1 or 2 days. It has to grow for scan to pick it up. The scan works by a law of mass action. The bigger the mass is, the easier for scan to detect. So there's a period for you to wait. While waiting, have faith and practice every form of relaxation technique to make your life comfortable and your life possible. Today, I've given you all this. There'll be a part 2 to this episode later. I'll take questions because it's all obviously time fast spent. If you have questions, ask me. Let's start answering them before it's too late. I can see a question on the screen here. Dopemu said, "Sir, what could be the cause of having milk in the breast when not pregnant?" If you have milk in your breast, if you're not pregnant, there's a high chance that your prolactin is high. Okay? High chance that your prolactin is high. Sometimes you're stressed. Sometimes you're taking some medications like antidepressant. They can make your prolactin level high. Okay? But if you're not taking any medication that can make your prolactin level high and you still got sustained milk in your breast coming out, even you're not pregnant yet, there's a high chance, like I said again, high chance that you have high level of prolactin in your system. And if you do have high level of prolactin in your system, there's a high chance that you're probably not ovulating. And if you're not ovulating, getting pregnant is going to be a challenge for you. So the first things you should do is to do your prolactin level, to check your level of prolactin. Go to any laboratory as soon as possible tomorrow morning, or even call ATG Laboratories and call Nike or Cynthia and tell them you want to come and do your prolactin level. And they'll check it for you and tell you what to do and even give you the full price details. You do your prolactin. If it's high, we give medications to bring it down. I've seen people just before, because they have breast in their breast coming up from their milk coming from their breast, they assume that their prolactin is high. They could be right, but the problem is they could be wrong. But the most important thing is that even if it's high indeed, how do you know what the level of prolactin was when you started treatment? And how will you monitor that the prolactin is coming down with your treatment? Whether you need to increase the dose, change the dose, or can't stop the dose. How will you know if you've not done the prolactin test as a baseline before starting the treatment anyway? So it's paramount important that you do this. So there's a question on here on Instagram from Infinity Palmer. She's saying, tell us about the success rate for someone that has overweight, someone that is not something. I can't see the rest. If you're overweight, somebody saying, please ping the ATG Cynthia number. Okay, the number here, one of the team members on ATG and moderators will put the details of the number of the lab on Instagram. So hold on, Ophidia. If you got high BMI, the success rate of IVF is lower, close to 30 to 40% or less. Okay, but if you reduce your IVF has to go to up to 50, 60. So reduce your weight, it makes IVF possible and much easier to be done. Why is IVF very risky in ectopic pregnancy? Why is IVF high risk in ectopic pregnancy? IVF increases that slight chance of having ectopic pregnancy. That is why once you have IVF done, we do a scan around 6-week pregnancy to check that the pregnancy is in the womb. Because IVF itself, because we're going to implant the pregnancy, for some reasons, statistically, there's a higher chance of ectopic. IVF itself increases the risk of ectopic pregnancy. The full reason, we don't know why, was because there's artificial involvement and all that. No, it increases the risk of ectopic pregnancy, okay? Thank you. Let's go back to Facebook and see some questions here. Doctor, is it possible? Yeah. And before your day, on the day of transfer of your egg, we always want to scan your womb to ensure that there's no fluid plenty in your tummy, in your womb cavity. If there's excessive fluid in your womb cavity, we don't transfer on that day, because by transferring your fertilized egg into your womb, if there's fluid in your womb, transferring the fertilized egg will cause miscarriage and probably failure of implantation. So we usually drain the fluid, or we might even postpone the transfer until a more reliable and feasible date. So we probably delay the transfer. There's a question here. Is it possible for a baby to contact malaria from the mother while in the womb? Unlikely. But malaria malaria parasite has a way of destroying the placenta, and it can lead to miscarriage. But baby can't get malaria while in the womb. No. But malaria has a way, has a way to destroy the womb, and they can cause holes, tiny holes in the placenta that can decrease its functionality and its optimal function, increasing the risk of miscarriage. So in pregnancy, malaria must be treated promptly. What is CQ10 for? It's an antioxidant. It reduces and slows down the aging process of eggs. So walk away, Edosa. I've already answered your question. There's a question here on Instagram. Hi, sir. What is the cause of immediate sperm leakage after sex? Is God. And it's normal. It's normal. It's a physical law of God. Anybody that has sex, okay, once she gets up on the bed, even if she ties her leg together like a fowl and throw the rope onto the ceiling, once she gets up, sperm will pour out of vagina. Once she go to pee, sperm will pour out. It's the law of Baba God. It's the law of Allah. It's the law of Jehovah. It's the law of the world. It's the law of physics. Once you get up after having sex, 10 hours after, 2 hours after, sperm will pour down. It's normal. It's semen. But inside the semen is sperm suspended. The sperm will have moved into your womb to go and get the egg. But the semen, that is the water, will pour out. The water is just the transport medium, is the bus that will carry the sperm to the bus stop. The bus stop is the womb. The sperm will swim into the womb. The semen will pour out. It's the law of God. As far as the sperm is good, you get pregnant if everything is okay. How long does metformin help regulate ovulation in PCOS? It could take 2 to 3 months. After doing IVF, result is ectopic pregnancy. Is there chances that second cycle will result in ectopic pregnancy? Yes, it's possible. If you had ectopic before in your first pregnancy from IVF, there's a slight increase in chance that you might have ectopic again. That is why we have, in some cases, if your tubes are damaged, what we do is that to reduce the risk of ectopic again, we go and totally clip off the tubes so that the ectopic pregnancy rate is totally reduced. Doctor, can IVF be successful with fibroid and endometriosis? If you have endometriosis, it's always good to treat it before the IVF, especially if you've done IVF before and IVF has failed. If you have fibroid, it's always good to remove it as well if you have obvious fibroid in your womb. Doctor, what causes fibroid to grow again? Honestly, we don't know. But what I know is that as far as you are still ovulating, as far as your ovary is not packed up, as far as you're not menopausal, as far as you're still ovulating, you're producing estrogens, your fibroid has the potential to be activated again or re-stimulated or reactive again or still be active again. So in that light, as far as you're still within your reproductive age, you can still have recurrent fibroids. You notice that you use folic acid in increasing your prolactin. Folic acid does not increase prolactin. Again, I repeat, folic acid does not increase prolactin level. Elaine Ibinovia, Iwelome, I've answered your question already. Okay, Elaine. Now I gotta go. Thank you everyone for listening today. I really appreciate you. God bless you. I hope to see you soon as well. Most importantly, I want to say I'm grateful for you to be here today, and thank you for your time, for listening to me. It gives me joy, and it gives me that undeniable joy all the time that you are here to listen to me. And honestly, I cannot deny my joy. I can't deny the fact that I'm happy and I'm joyful for this. So all the best, and get set for our seminar coming up this month, May. If you attend our seminar this May, like you attended in April, some people that attended the seminar in April, that attended in May, you're going to get discount if you need IVF at the ATG IVF Center that is opening in June this year. Thank you and have a wonderful day. Have a wonderful rest of your week. God bless you and see you soon. Bye-bye.
Let's calculate, Baba. How much you get, how much you pay, Baba. I want to live for what you earn, Baba.